Hello, and welcome to the Living Well education session for hip and knee arthritis. My name is Kara, and I'm a physiotherapist with Interior Health in Kamloops. We are here today to learn how you can better manage your arthritis while you wait for surgery, to prolong your surgery, or to possibly avoid surgery completely. As most of you will eventually go on to have joint replacement surgery, we will spend some time talking about how you can prepare for this, because people who are informed and prepared generally recover faster from surgery and have fewer complications. Over the next 30 minutes or so, we will be covering what is osteoarthritis, optimizing nutrition, joint protection and self-management, maximizing movement and function through physiotherapy with a focus on goals, improving your strength and endurance with exercise guidelines, equipment needs, dental care and medication, and what comes after today. In addition to this presentation, you should also have received a hip or knee joint replacement surgery booklet, a hip and knee optimization passport, and a sheet of exercises to try at home. All of these resources can help you manage your arthritis and help you to prepare for surgery. You will also find much of the information we will be covering today in these handouts. So what is osteoarthritis anyway? Osteoarthritis, or OA, is the most common type of arthritis. It occurs when the protective shock absorbing layer of cartilage that is found in joints wears away. Osteoarthritis can affect all age groups, but it is a degenerative process, so once you have it, it will progress with age. Osteoarthritis can cause symptoms of joint pain, stiffness, and swelling. Typically, the weight-bearing joints such as the hips and knees are affected most often. While the cartilage damage caused by osteoarthritis cannot be reversed, we can take steps to manage the symptoms. The ultimate treatment for osteoarthritis is joint replacement surgery, where the areas of the joint with damaged cartilage are removed and replaced with artificial components. So where do we start? This pyramid shows stages of intervention for arthritis. We are going to start at the bottom and work our way up through this presentation. We will start by discussing nutrition, joint protection, and self-management strategies. It's long been known that the nutrients we receive or don't receive from food affect our health. Surgery is a major event for your body, and you can assist your recovery by fueling it with highly nutritious food both now and after surgery. The Canada Food Guide recommends that for optimum nutrition, half your plate at each meal should be vegetables and fruit. Including a variety of dark green and orange vegetables is important, as these vegetables are particularly nutritious. The rest of your plate should be made up of 1/4 protein foods such as meat, fish, beans, and lentils, and 1/4 whole grains such as whole grain bread, whole wheat pasta, quinoa, and brown rice. It is also important to include plenty of fiber in your diet and to make sure you are well hydrated with water. Some pain medications used to manage osteoarthritis can cause constipation as a side effect, and you can help prevent this with your diet. If you feel that your diet could use some improvement, but you aren't sure where to start, you can look at the Canada Food Guide website for further information, or you can call 811 and ask to speak to a dietitian. Improving your diet doesn't have to be complicated or include any expensive diet foods or supplements. In addition to filling half your plate with vegetables and fruit at every meal, here are a few more tips to help get you started. Number 1, listen to your body and do not eat if you are not hungry. If you find yourself eating for other reasons, such as out of boredom or out of habit, now may be a good time to find other ways to cope with these feelings. Number 2, pause before you are full and take a moment to decide if you're still hungry. It's best to eat until you are no longer hungry, rather than to a point of feeling stuffed. Number 3, regulate portion sizes. Sometimes switching to a smaller plate can be helpful if excessive portion size is an issue for you. Number 4, don't skip meals. It is healthier to eat small, regular meals than to skip meals, which can cause the body to think it's entering a starvation state, causing it to store fat. Number 5, keep healthy snack choices readily available. If you don't have healthy snacks prepared and readily available, You will be less likely to reach for them when you're hungry and more likely to reach for less nutritious convenience items. Number 6, make it easy. There are many healthy pre-prepared fruit and vegetable options at the grocery store. You can get pre-washed chopped vegetables in the produce section, and there are many easy to prepare fruit and vegetable options in the frozen section that are just as nutritious as fresh. And lastly, ask for help. If you are needing to improve your diet but are feeling lost, call 811 and ask to speak to a dietitian. They will be able to provide you with help and guidance to get on the right track. If you have diabetes, it's important to ensure that your blood sugar levels are tightly controlled before surgery. When your blood sugar is in the normal range, your blood flows through your body with the consistency of skim milk. When your blood sugars are higher, your blood gets thicker and can't move around your body as well. Blood is responsible for moving oxygen and nutrients around your body to help it heal. So when your blood sugars are higher, your body cannot heal as effectively, and your risk of infection is increased. With total joint replacement, an infection in your artificial joint often requires further surgeries to cure the infection, so it's important to keep your blood sugars under control to help prevent this. So what can you do? You can test your blood sugars regularly and at different times of the day to help you understand how food affects your blood sugar and how your blood sugars change through the day. Get your A1C tested every 3 months and know your number. You can try increasing the amount you're exercising, as this can help improve blood sugars. And you can ask for help by contacting your local diabetes education center, family physician, or nurse practitioner. Self-management. What are some things you can do now to optimize your health and cope with the symptoms of arthritis? We'll start with joint protection through weight management. When you weigh less, there's less demand on your joints. Every pound of weight you carry results in an extra 4 to 6 pounds of stress on your joints. A little weight loss can make a big difference to the wear and tear on the cartilage in all your weight-bearing joints, not just the one that's worn out. For example, if weight is an issue for you, losing just 10 pounds can reduce the stress on your joints by about 50 pounds. Your weight also plays a factor in post-surgical recovery and the long-term results of your prosthesis. Patients report that they have more discomfort in a joint that has been replaced if their weight goes up than if they can keep it down. Obesity is also linked to a number of other health conditions, including heart disease and diabetes. So if weight is an issue for you, you'll be doing more than your joints a favor by starting to get it under control. Everyone knows that smoking is bad for your lungs, but not everyone knows that smoking is bad for your bones. Nicotine breaks down bone faster than bone can rebuild itself. Smokers are also at a higher risk for slower recovery from surgery, infection, and complications than non-smokers. If you are considering joint replacement surgery, now is the time to quit, or at least cut down on the amount you smoke. If you feel you could use some help with quitting, there are many resources available at quitnow.ca. To help manage arthritis pain, both ice and heat can be helpful before surgery. Some people find one works better than the other, and some people like to use both. If you haven't already tried ice or heat, feel free to try them both and find what works best for you. If your joint is inflamed, painful, and swollen, ice can help to reduce these symptoms. When using ice, it is important to protect the skin by covering the joint with a towel before applying ice so that the ice is not directly in contact with the skin. Ice can be applied for about 20 minutes at a time and can be repeated as often as every 2 hours. While ice can be helpful for some people before surgery, it will be particularly helpful for swelling and pain control after surgery when your joint will be painful and swollen. Before surgery, heat can be used to decrease joint stiffness, relax tense muscles, and stimulate blood flow. Moist heat, such as a bath, shower, or towel dampened with warm water, can be particularly helpful. As with ice, heat can be applied for about 20 minutes at a time and can be repeated every 2 hours. Some people also find it helpful to alternate between ice and heat, using ice for 20 minutes, then taking at least a 20-minute break before using heat for 20 minutes. If you have diabetes or poor circulation, you will need to be careful with heat to avoid burns. Also, heat should not be applied to a joint that is already hot and swollen. As this will be the case in the short term after surgery, it is important not to use heat in the immediate post-op period. Next, we will look at some exercises you can do to improve your strength and function now. These exercises are all on your exercise handout, and you should try them at home. If you find yourself struggling with the exercises, you may want to consider consulting a private physiotherapist in your community. Exercise benefits virtually all of our body systems, not just our muscles and joints. It helps with our cardiovascular health, strength, balance, mental health, and overall well-being. To maximize the benefits of exercise, it is important to do a variety of exercises each week. Strengthening exercises are needed to optimize the strengthened leg muscles that will be disturbed during surgery, and to develop strong arms and core muscles that will help you mobilize more easily after surgery. Stretching the muscles around your affected joint can help to loosen tightened muscles and will help you recover range of motion after the operation. Aerobic fitness, that is, anything that increases your heart rate and breathing, is also important, as it can give you more energy and build your endurance. For regular physical activity, you should try to do some exercise on most days of the week, aiming for a total of 150 minutes spread out throughout the week. You should choose moderate intensity activity, which is enough to push yourself a little, but not wear yourself out. Everyone will be at different levels of activity, so you need to find what is doable for you. If you are new to regular exercise, you may find it most manageable to start with small sessions. Even 10 minutes is a good starting point, and gradually increase to 30 minutes per session as you are able. Remember to include a variety of exercises for strengthening, stretching, aerobic activity, and balance. Exercise can be a hard habit to start if it's not something you're already doing regularly, because it can feel like work. Knowing what you do now about the particular importance and benefits of exercise for your surgery, you may want to set some firm goals to help motivate yourself. When setting goals, they should be SMART, that is, specific, measurable, achievable, realistic, and timely. For example, your goal might be to walk briskly for 7 minutes 2 times a day by the end of the week, starting with 1 minute twice a day and adding an additional minute each day. At the end of the week, you will know if you have met your goal or not. If you have, great, time to set a new goal. If you haven't, that's okay. You can either set a new goal or revise your current goal to make it more realistic and achievable. If regular exercise is going to be a new thing for you, and you have chronic health conditions such as diabetes or heart disease, you may want to consult your physician about your ability to exercise safely before beginning. When you have arthritis, the muscles around the joint become weak and deconditioned. While joint replacement surgery can fix the joint itself, it does not do anything to improve the muscles and tissues around the joint. After surgery, you will need to do some exercises to help these muscles and tissues recover. However, if you can get these muscles and tissues in better shape before surgery, your recovery will be easier after. This is where the following exercises can help. All of these exercises are on your handout of exercises you can try at home. Exercise number 1 is bridging. This is an excellent exercise for your leg, tummy, and back muscles. Lie on your back with your knees bent on your bed or the floor if you're able. Lift your hips as high as possible and hold for a couple of seconds before slowly lowering back down. Repeat the exercise 5 to 10 times. Exercise number 2, quads over a roll. Find a rolled up towel, cylindrical cushion, or a large coffee can with a towel wrapped around it and place it under your knee. Slowly lift your heel to straighten your knee and hold for a couple of seconds before slowly lowering. Repeat this exercise 5 to 10 times. If you find this exercise is too easy for you, you could try adding an ankle weight around your ankle. Exercise number 3, chair push-ups. This is an important exercise for strengthening your arms in preparation for using a walker and crutches after your surgery. Find a chair with arm rests and push up with your arms. Hold for a couple of seconds, then slowly lower. Try not to use your legs to help. Repeat the exercise 5 to 10 times. Knee extension. Find a firm, straight back chair. Keeping your thigh on the chair, lift your foot to straighten your leg. Hold for a couple of seconds, then slowly lower. Repeat 5 to 10 times. Again, if you find this exercise is too easy, you could try adding an ankle weight around your ankle, or use a TheraBand between your ankle and the back leg of the chair. Exercise number 5, core stability. I don't have a video of this exercise, but you can try it where you are sitting right now. Start by moving your hips to the back of your chair and sitting up tall. Draw your belly button back toward your spine to make your stomach muscles firm and hold for 5 to 10 seconds. Make sure that you continue breathing while you're holding. You may need to focus on your breathing while doing this exercise, as most people will automatically inhale and hold their breath while drawing in their belly button, like so. So make sure you're breathing while you're holding. After the hold, relax your stomach muscles and repeat 10 to 20 times. Exercise number 6, sit to stand. Find a firm chair and try to stand using your leg muscles only. Try not to rock your body and use momentum to stand. If this exercise is too difficult for you, you can start by using your arms if needed, or by placing a book on the chair, as seen here, to make it higher. As your strength improves, try to reduce the amount you are using your arms, or remove the book. Repeat 5 to 10 times. Exercise number 7, heel raises. Find a spot where you can stand and hold onto a sturdy counter or chair for balance if needed. Slowly push up onto your toes and hold for a few seconds before slowly lowering back down. Repeat 5 to 10 times. Standing side leg lift. Find a spot where you can stand and hold onto a sturdy counter or chair for balance if needed. With your toes pointed forward, lift your leg out to the side. Hold for a couple of seconds, then slowly lower. Try to make sure that your body stays upright and you're not leaning over as you lift your leg. Repeat 5 to 10 times. Single leg balance. Again, find a spot where you can stand and hold onto a sturdy counter or chair for balance if needed. Pull your belly button toward your spine like you did in the core stability exercise to keep your core muscles strong. Try to stand on one leg without letting either of your hips drop or twist. Hold as long as you're able to maintain good form. Repeat 5 to 10 times on each leg. Exercise number 10 is cardiovascular exercise. This is not on your sheet because it will be different for everyone. This is the type of exercise that gets your heart rate and breathing going. It includes walking, cycling, elliptical, swimming, and rowing. If you are not regularly doing any type of cardiovascular exercise at the moment, start with short exercise periods and add minutes as you improve. If you choose to try walking, soft, flat surfaces will be easier on your joints. If you choose cycling, low gear tensions will put less stress on your joints. When choosing types of cardiovascular exercise, it is important to avoid activities that increase stress on damaged joints, such as jogging, jumping, or the Stairmaster. Every time I give this presentation, someone tells me that they can't exercise because of their hip or knee. I believe that everyone can exercise. It's just a matter of finding the right exercise for each person. All of the exercises I have presented today are only suggestions. There are lots of other ideas out there, so I would encourage you to look online, in books and magazines, and at your local gym or rec center for something that will work for you. The key is to find something that you can manage, and ideally something that you enjoy. If it hurts to walk, try walking in the pool to reduce the pressure on your joints. If you can't exercise standing up, there are lots of exercises that can be done sitting in a chair, including cardiovascular type exercise. If you prefer exercising in a group or with friends, look for an exercise class in your community. If you don't feel like you have time to exercise, break up the activity and start by squeezing in 10 minutes twice a day. Everyone can find just 10 minutes in their schedule somewhere. Remember to always exercise within your pain limits. If a particular exercise hurts, find a different exercise that doesn't. Don't give up. If you're feeling lost and don't know where to start or how to progress, you can always call 811 and ask to speak to an exercise specialist or consult a private physiotherapist in your community. Remember that every move is a good move, and even small amounts of exercise can help. So please try to find something that works for you and make it a habit. Next, we will talk about some equipment that may help you before surgery and will definitely be needed for a short time after surgery. First, mobility aids. This includes canes, crutches, walkers, and walking poles. The use of a mobility aid can decrease the forces through the hip and knee joint by 30 to 40%, which in turn helps decrease the pain in these joints. Mobility aids can also help prevent limping, which puts more strain on other areas of the body, such as your good leg and your spine. If you find yourself walking with a limp, you should consider using a walking aid to reduce the limp and the amount of strain you're putting on the rest of your body. If you are using a cane, it should be held in the hand opposite the painful leg, meaning that the cane will be on the same side as your good leg. Holding the cane on this side causes you to shift your body weight toward the cane and your stronger side and away from your weaker, more painful leg. In terms of height, both canes and walkers are sized in the same manner. Wearing your regular walking shoes, stand with your arms relaxed at your sides. In this position, the handle of your cane or walker should be at the level of your wrist crease. Another type of mobility aid to consider is activator poles. These poles are specially designed to encourage proper posture, core activation, in addition to reducing stress and impact on knee and hip joints. They can help to improve both walking tolerance and gait speed, both before and after surgery. While they are similar to Nordic walking poles, they have a few unique features, including ergonomic hand grips and a wider tip at the base. If you are considering purchasing a pair, they are available online or in a few stores in both Kamloops and Kelowna, but you need to look specifically for the activator brand, as other Nordic walking poles don't necessarily have the same benefits. To adjust the poles, you want to have the handles comfortably in your hands when your elbows are at your sides and bent at 90 degrees. Please note that Interior Health is not affiliated with either Urban Poling or the Activator brand. In terms of other equipment that may help you now, the bathroom is where most of the safety equipment will be needed. You will need many of these items short-term after surgery, but some of them can also be helpful beforehand. If you're having difficulty getting on and off the toilet, a raised toilet seat can be helpful. If you have difficulty standing to shower, a bath stool or bench allows you to sit while you wash. A clamp-on tub rail or other grab bars can be helpful in the bathroom as well if balance is an issue. If you have difficulty reaching your feet or the floor, a long-handled reacher can help you grab things you have dropped and can also be used to help you get your pants on. If shoes and socks are an issue for you, a sock aid and a long-handled shoehorn can help you maintain your independence with these tasks. All of this equipment is readily available for purchase or rent from medical supply stores and some pharmacies. If you feel some of these items would be helpful to you before your surgery, I would encourage you to consider looking into purchase or rental. After your surgery, you will require some of this equipment for the short term. You will be provided with a Red Cross form when you come to your pre-op appointment, which will allow you to borrow the equipment you need from the Red Cross for a couple months after your surgery. Moving up the pyramid, we will now discuss pain medication and dental work. If taking pain medication allows you to stay more active, then it can have a great overall benefit. After your surgery, it will be important to take pain medication regularly as prescribed by your doctor to prevent pain from building up and getting out of control. Taking pain medication regularly is also something you can consider before your surgery if you and your doctor or pharmacist feel it would help. Please discuss your medication use with your family doctor or pharmacist, especially if you have any questions about how much you should take. In terms of dental care, it is important to take good care of your oral health both before and after joint replacement surgery, as the mouth can be a potential source of bacteria and infection that can spread to an artificial joint. It is recommended that if you require dental cleaning or minor dental work such as fillings, this must be completed a minimum of 2 weeks before surgery. If you require major dental work, like a root canal, extraction, or reconstructive work, this must be completed a minimum of 6 weeks before surgery. Your surgery may have to be postponed if there is obvious dental decay or infection noted before your surgery. So if there is some dental work you've been putting off, now is the time to get it taken care of. So on the path to joint replacement surgery, what comes next? If you have not already spoken with a surgeon, that is the next step. Once you and your surgeon have decided that surgery is the right option for you, your name will be sent to the Royal Inland Hospital OR booking office, and they will contact you with a surgical date when one is available. As there is a lengthy wait list for hip and knee joint replacement surgery, this can take considerable time. When it gets closer to your surgical date, you will receive a phone call from a nurse navigator for pre-surgical screening. This is to collect an up-to-date medication and health history, to review pre- and post-op teaching, and to coordinate any pre-op lab work, x-rays, and EKG. You will also receive educational information from either a physiotherapist or occupational therapist on what to expect during your hospital stay, tips for managing functional activities when you get home, such as getting dressed, exercises to do after your surgery, and how to access the equipment you will need after surgery, including items such as a walker and raised toilet seat. After all the preparation, of course, comes the actual surgery and your optimal recovery. In the handout package you received with this presentation, you will find a hip and knee optimization passport. This document can be used to help you set goals to improve your health and to create an action plan for working toward these goals. Please take the time to consider which areas of your health you could improve and use this resource to actually write down some goals and action plans for yourself. This booklet also contains many valuable resources that you can use to help you reach these goals. In closing, it's important to be an active participant in your pre-op preparation and post-op rehabilitation. The long-term success of your new joint is up to you. Proper nutrition and not smoking are keys to optimizing your body. Try to reach a healthy weight if you're not already there, as this will make things easier on all your joints. Try to keep your pain under control as best as you can. You can use ice, heat, medications, mobility aids, and a balance of exercise and rest. A reminder that it is crucial to have outstanding dental work completed due to the risk of infection. The cutoff for cleanings and fillings is 2 weeks before surgery, and the cutoff for major dental work is 6 weeks prior. After surgery, you should avoid all dental work for 3 months or consult your doctor and dentist prior. Be sure to stay in contact with your nurse navigators, particularly if your health changes. They can be reached by phone at the number listed both on the screen and in your optimization passport. If you have any further questions or concerns about the information that was presented today or about your surgery, please contact your nurse navigator or your local physiotherapist. And finally, Thank you for taking the time to learn how you can better manage your arthritis and optimize your health for surgery.